In order to see more improvements and development for men's health, there is a need for more funding. The Men's Health Network is a national nonprofit that advocates for the most pressing issues in men's health, such as prostate cancer, the gender lifespan gap, mental health stigma, and health disparities among different groups of men. For us to be able to continue our work in improving the lives of men and boys across the United States, we need proper funding not only for our organization, but for men's health as a whole. Men currently live 6 years less than women on average in the United States. This should not only be alarming to men because it is an issue that affects everyone. With more funding, organizations like the Men's Health Network will be able to achieve groundbreaking discoveries and implement ways that can help solve these critical health concerns. At Men's Health Network, we have national initiatives such as Your Cancer, Your Plan that aim to reach men across the United States and provide them with resources about navigating their cancer diagnosis. Health literacy is one of the most important factors to consider when trying to reach the public about their health concerns. Many men have been taught from a young age that they should not openly talk about their health, making them more likely to misunderstand health concerns that largely impact them. Due to this, Men's Health Network prioritizes educational resources and ensures that men have a foundational understanding of their health. We have even began to offer an online course to become a certified men's health educator. Cardiovascular health is another issue that we greatly advocate for at Men's Health Network. We attend local health fairs and distribute educational material to men and women about cardiovascular health. Prior research has told us that men respond best to health interventions that happen in their place of work. We apply this research to our initiatives and make sure that we distribute resources at the workplaces of men. This is just one example of why research about men's health needs more funding because we are able to use this discovery efficiently. Setting goals is one of the best ways to stay motivated and on track with our missions at Men's Health Network. We have a set time frame for our goals and aim to have completed a lot by the end of the decade. This includes increasing the average male lifespan past 75 years old. Our strategy for this is mainly through legislative advocacy, where we are working towards improving how federal and local agencies coordinate men's health initiatives. Men's Health Network also has GAP Guides, a free online resource that tells men how they can work towards closing the gender lifespan gap. While we recognize the need for governmental action on men's health concerns, Men's Health Network also has initiatives like the GAP Guides that target men individually. Research has informed us that a mixture of governmental actions, community organizations, and individual resources work best to advocate for men's health concerns. Men's Health Network has built their entire strategies and goals on the research we have conducted about the most productive ways to handle these health concerns. Being able to conduct more research could even help us reach our goals before the end of the decade. Building a network across the United States is one of the most prominent ways that Men's Health Network advocates. Another one of our goals is to host over 50 events to increase the accessibility of healthcare for men who are at an increased risk of disease. Through these events, we work with faith-based communities, nonprofits, and community health centers. At these events, we inform people about ways that they can get involved in improving men's health and the work that Men's Health Network does on a national level. Building support in local communities is one way that we advocate for more funding for research in men's health. Many people who are not involved in the health industry may not be aware of the lack of research that is currently done specifically about men's health issues. If more people are aware of these concerns and educated on how important the research is, then we will have gained more public support. Building support from local communities is one of the best ways we advocate for funding for Men's Health Network because we want people to see and feel the impacts we are trying to make. Even though Men's Health Network has many community-based initiatives, we also aim for men's health as a general topic to receive research funding federally. As a nationwide nonprofit that is based in Washington, D.C., we often involve ourselves with the federal government. Throughout our involvement with the federal government, we advocate for the creation of a Men's Health Policy Council that will work towards implementing policies and research fundings for men's health. Currently, there is no federal office or council on men's health. This makes it difficult to advocate for men's health research funding because there is no federal organization that handles men's health specifically. Despite this, Men's Health Network continues to meet with policymakers and attend congressional meetings to lobby for policies and funding that can help improve men's health outcomes. If men's health research received more federal funding, there could be more findings to help improve low-income men's access to preventive screenings and health insurance. There could also be more representative research that focuses on the most high-risk populations, such as African American men and sexual minority men. All of these critical issues in men's health cannot be properly addressed without adequate research, which is why there is such a need for more funding. Moving forward, Men's Health Network will continue to advocate for men across the United States. With our current plans, we hope to make huge improvements in men's health by the end of the decade. This means expanding access to preventive screenings, improving health literacy, and conducting research to help underserved men, and attending local community events to educate the public about the most prevalent issues in men's health. Although Men's Health Network has and will continue to advocate for these causes, we will be able to achieve more if there was increased funding for research. Men's health is a public health concern that should be prioritized by all people in the United States. With more funding for research, Men's Health Network would be able to develop new strategies to meet our goals of closing the gender lifespan gap, eliminating mental health stigma, suicide prevention, and fighting cancer. These are all health concerns that are in need of more research because there is minimal that has been done about how these diseases and illnesses specifically impact men. Research funding not only for Men's Health Network but for men's health research as a whole will help make a huge difference in the field of public health in the United States. Men's health research is not conducted as much as it should be. The main issues that are happening in the field of men's health are the lack of preventive screenings, high prostate cancer diagnoses, and the stigma that men face when they try to receive help for these concerns. In order to successfully handle and eliminate these problems, more research needs to be conducted on the best strategies. Prior research has displayed that men respond better to health interventions when they are conducted at faith-based organizations or their workplaces. Using these findings, Men's Health Network has been able to reach wider audiences of men and inform them about their health. By continuing the research about this topic, we might be able to find new and more successful ways to address our major priorities.